Welcome, Dr. Sushanta Goswami. So today we'll be discussing about diabetes in general. And to all our listeners, the whatever we are discussing, it is about educational purpose. We suggest you not to start any medication or stop any medication because of whatever we discuss here. And thank you and good luck. Dr. Goswami, let's start.
Okay, let's discuss about diabetes. There are two types of diabetes. Diabetes mellitus, which is actual diabetes sugar problem. There's another diabetes called diabetes insipidus, where people lose a lot of water from the body by urinating. That's another problem that occurs due to brain problem. So today we are discussing diabetes mellitus. Now, what is diabetes? Why we're so interested about diabetes? Because it is the second most common medical disease next to high blood pressure. We discussed about high blood pressure on our last 5 sessions and their complications and treatment. In this, we'll do another 5 sessions about diabetes, their treatments, medications, complications, etc. Let me tell you an overview of diabetes, why it is so important, why it is the second most common disease in the human being. Number one, as per epidemiology is concerned, almost 40% of world population are diabetic. And it has been an American Diabetic Society Association. They have estimation that 285 millions of people worldwide are diabetic in 2010. In 2030, this population will be 438 million, almost doubling. So diabetes is going up and we have to prevent it. And what are the dreadest complications of diabetes? There are many complications, but in simple language, let me tell you 5 important things about diabetes. Number one, blindness. You should not control your diabetes. Within 10 years, you'll be blind. Blind from a retinal disease, blind from cataract. People who have diabetes, they develop cataract 5 to 10 years before. So you have to do cataract operation. Number two is amputation. Diabetic causes problems in the blood vessels, blockage in the blood vessels. So you have a less circulation to your extremities. The most common amputation is the leg amputation, below knee or above knee. So you lose a limb. You'll be walking the rest of your life with a walker or a stretcher. Number three complication is heart attack. Same thing it does to the leg. The blood vessels are closed due to diabetes. Same thing happens in the heart. The blood vessels are stenosed. You need cardiac stenting. You need bypass. And that happens more often with diabetic than non-diabetic. The number five is stroke. People get blood clot on the brain because of diabetes. Their bilateral carotid arteries on the neck get stenosed. You need operation and clean them. That happens more often in diabetic, much earlier in diabetic than the normal population. The last one is dialysis. If you are diabetic for 10 years, your kidney will be gone and you will have dialysis. Even if you have diabetes, you need to control it so that you don't get into kidney problem. But the way people treat themselves, they don't take medicines properly, they have too much of busy lifestyle, industrialization, lack of exercise. They don't have time to eat good food or cook good food. They just eat fast food in the restaurants. They have half an hour to report back to their work or their lab. So this kind of hectic life, industrialization, lack of exercise, and the obesity, those are contributing to diabetes. So that's why it's very important to protect your bodies, your organs from diabetes. And that's why I want to know about diabetes, how to prevent, what are the lifestyle modifications, what are the drugs. The drugs don't work, what are the insulin? If the insulin don't work, what are other things? Transplantation of the pancreas. I was working in a transplant hospital. They have pancreas transplantation. Your whole pancreas is gone, and the diabetes is because of the mostly pancreatic disease. So we'll talk about all those things now. Now, what are the types of diabetes? Then we'll go to definition of diabetes. Types of diabetes, number one is type 1, number 2 is type 2. Type 1 is basically immunological mediated, like people who have rheumatoid arthritis, people who have psoriatic arthritis, people who have lupus. A lot of people have autoimmune and disease, and they produce antibody against their own organs. So what happens if your body starts producing antibody against your pancreas, which secrete insulin? You will have insulin antibodies, then you'll have diabetes. So diabetes happens from two reasons.
Hello, Dr. Goswami. You are by mistakenly muted. Can you please unmute on your screen, right hand side, top?
Okay, you got it?
Yeah, thank you. Can you please repeat what you told in last 2 minutes?
Yes, I wanted to tell you that most of the diabetes, cause of diabetes is because of insulin secretion or utilization problem. Pancreas is an organ in our body that secretes insulin. If the insulin is not secreted properly, or insulin antibodies are there, that means you don't have much of insulin, then you'll have diabetes. So what insulin does, it causes your sugar in your blood to absorb to different organs. If you don't have insulin, your body will be lot of sugars in your blood, then nothing will be utilized by your cell. Your brains will not have sugar, your heart will not have sugar. All the cells of the body, they depend on sugar to survive. So if you have diabetes, you will have a lot of sugar in your blood, but no organs are utilizing them. So you have a lot of sugars in the blood floating all around, but nothing is going to the cell. So like you are like in the ocean, you are swimming in the ocean, you are very thirsty. You can't drink ocean water, it's too salty. So it's no good to you. You're not able to drink that water. That's what happens. In diabetic, the blood sugar is so much high, people are floating with high blood sugar, but they can't use it. The tissues are not using, there are defect in the tissues, not using the sugars in your blood. And that is done by insulin. Insulin helps the sugar get into the cell, and that's how we live. If you have problem in insulin that is secreted by pancreas, then we'll have diabetes. So there are two types of diabetes. One is type 1, that is an insulin secretion problem, or insulin antibody, that whatever insulin is secreted, it is blocked by the antibodies in your body. Next one is insulin utilization problem. Your pancreas may be completely normal, but the cells of your body that has a insulin receptors, they are destroyed, or they are having problematic receptor problems. So they can't utilize whatever insulin we have. So that is called the type 2 diabetes. So type 1 diabetes is insulin secretion problem. Type 2 diabetes is insulin utilization problem. So we'll discuss all about that. Now, there are many other types of diabetes. So we have to know why diabetes happens. Genetic. Genetic is mostly type 2. 90% of the diabetes are type 2. Only 10% are type 1. Type 1 diabetes, almost no insulin or very less insulin. So they have to be given insulin to survive. But type 2 diabetes have a lot of insulin, but the insulin is not working at the receptor level properly because there is some receptor defect or some problems. So in those cases, you don't have to have insulin. You can use medication that will sensitize your receptors to insulin. So insulin can act faster. Those medications are called insulin sensitizers. So what are the other causes? So most of the causes I'm telling about type 2 now, because 90% of the people have type 2 diabetes. What are the causes? Number one cause is MODI, M-O-D-I, called maturity onset diabetes of young. People, they have type 1 to type 6 varieties of MODI. MODI 1, MODI 2, MODI 3, MODI 4, MODI 5, MODI 6. Mostly what happens, whenever this is a maturity onset diabetes of young, when the younger population, they get matured, they become 20 years, 30 years of age, the time some of them are obese, they don't have exercise values, they don't just have disciplined lifestyle, they gain weight. The more obese you are, the more chance of you become diabetic. What happens in obese patients? You have fat not only on your skin, but also fat in your omentum, inside your organs, around your blood vessels, everywhere there will be fat. So what happens? Our tissues which utilize the insulin, they have insulin receptors, mostly the skeletal muscles and the liver. They are the most important peripheral tissue that utilize insulin. They are all covered with fat. So the receptors are buried under fat. So insulin might be floating around, but don't get the receptor to get into. That's why obese people get diabetes, because they have insulin, they can't utilize insulin because the receptors are buried under fat. When you lose weight, the fats get lysed and the receptors pop up like flower buds. Then insulin gets into it. That's how you lose weight, your diabetes is controlled, and you don't need to take medication or insulin. Number two is pregnancy, called gestational diabetes. If you are pregnant, you gain weight, you gain fluids, you have a baby weight, all those things that cause prone to diabetes, cause gestational diabetes. Most of the time when the pregnancy is done and baby is delivered, the diabetes is gone. But in a few percent of cases, they remain diabetes for the rest of their life. Number three, problems with pancreas. There are different kinds. Pancreas has two different kinds of system. One is exocrine, one is endocrine. Endocrine means whatever they are secreting into the blood, the hormones like insulin, glucagon, they are the endocrine function of the pancreas. The exocrine means these secretions are not secreted into the blood, but secreted into the gastrointestinal tract, secreted around the biliary tract, not to the blood directly, but to the different parts of the body. They're called exocrine. So, but if you have exocrine pancreatic deficiency, like you have a disease of the pancreatic cancer, you take out the whole pancreas. So there is no pancreas, there is no beta cells, there is no insulin producing cells. So you have to take insulin and they become diabetic. Now, if the pancreas has, there are other conditions where the pancreas has like cystic fibrosis. The pancreas has a lot of fibrosis. The pancreas cells um, are basically replaced by the fibrotic tissue. So the cells are not there, only fibers are there. What good is this for you? They are not secreting insulin. They are just fibrous. They are just making pancreas harder and harder. They destroy the fibrous deposits, destroy the pancreatic cells that secretes insulin. So I become diabetic. There's another condition. It's called hemochromatosis. Like this is a condition where there's too much of iron starts depositing in various organs on your body. It's called iron deposition syndrome. They also gets deposits to liver. They also get deposits to the pancreas, and they destroy the pancreas, and then you don't have any cells, beta cells, to secrete insulin. So you become diabetic. And there are some infections in childhood: rubella infection, cytomegalovirus infection, Coxsackie virus infection, mostly viral infection during childhood, they specifically attack the pancreas, and pancreas is damaged. When you grow up, 50% of pancreas is damaged, and you are prone for diabetic. Number 5, there is a condition called Stiffman syndrome. This is a new thing that I didn't know when I was studying in my medical school. You know, famous singer Celine Dion from Canada. She's a soft rock singer, has a very famous singer, and she's suffering from. She's not able to. She just canceled her Europe trip a month ago because she has a Stiffman syndrome. And the Stiffman syndrome, what happens? They have a lot of things happening, and one of them is they have insulin antibodies in their body. So they attack the insulin secretion process, and they become diabetic. Another thing is drug-induced diabetes. What are the drugs that cause diabetes? You should avoid in a diabetic patient, or in order not to get high sugar, you need to avoid those drugs. One is hydrochlorothiazide. It's the most common medication for use of high blood pressure. Hydrochlorothiazide that causes hyperglycemia. Number 2 is steroids or prednisone. You have asthma, you have some autoimmune disease, sarcoidosis, psoriasis, you need to take steroids. And those steroids will gain weight, and ultimately you will become a diabetic. Number 3 is protease inhibitor. HIV patients, there are different kinds of HIV medications. One of them is protease inhibitors, and those cause diabetes. Another is transplant medication. Like you have a kidney transplant, liver transplant, pancreas transplant. So there are 2 common medications that are used called tacrolimus and cyclosporine. And those are diabetic. Especially tacrolimus causes diabetes. So people with diabetes, you need to use less tacrolimus transplant medication than something other transplant medication, more and less of tacrolimus. Then beta blockers, they cause hyperglycemia, hypertriglyceridemia. So less common use, the less you use beta blocker is good for diabetes. So these are the causes of diabetes. And who are the people who gets diabetes? Mostly it's black. African Americans are the most common cause diabetes. Number 2, second is Hispanics. Third is Orientals. Fourth is Caucasians. The Americans and whites, they have less chance of diabetic than the other Orientals and blacks and Hispanics. Then what are the other risk factors? Another risk factor is high blood pressure. Blood pressure more than 140/90 put you on a risk of becoming diabetes in the future. Then the cholesterol. If you have high cholesterol, especially triglyceride level, normal triglyceride level is less than 150. But you have more than 250 triglyceride level that specifically attack high triglycerides specifically attack the pancreatic cells and damage them. So the more you have high triglyceridemia, the more your pancreas will be damaged. Then you will be diabetic. Then there is a condition called acanthosis nigricans. On the armpit of different people, you see there are black spots, and they are specifically cause acanthosis nigricans. And those are people very susceptible for diabetes. Another is polycystic ovarian disease. In women, if you have a lot of cyst on your ovary, that's called polycystic ovarian disease. They gain weight and they become diabetic. So these are the risk factors of diabetic. I'll take 5 minutes. We have 5 minutes?
Yes.
Okay. I'll take 5 minutes to tell the definition of diabetes. Then we can do discussion of medications and other things next session. So there are three criteria for diabetes. Number one is pre-diabetic. Next is diabetic. So pre-diabetic they are just on the borderline of diabetes, but if they don't control themselves, then they tip over to become a frank diabetic. So number one definition is fasting blood sugar early morning. It has to be more than 126. And that why 126? There are a lot of research have gone through. They have done research that see what level of blood sugar cause eye damage, cause heart attack, cause stroke. And they figure out after a long discussion, many papers published, they decided 126 is the one where you have diabetes. Number one definition. Fasting blood sugar more than 126. It has to be done in 2 different times to conform. Number two is your random blood glucose. Anytime you take blood glucose, has to be more than 200. Plus, you have signs and symptoms of diabetes. It's not 200 more than 200. Say you have 220 blood sugar, but you don't have symptoms of diabetes. That's not diabetic. So we have to have 2 criteria. Number one, random blood glucose anytime you do is more than 200, plus you have the symptoms of diabetes. What are the symptoms of diabetes? There are 5 P's. P is polyuria. You'll be urinating a lot. Number 2 is polydipsia. You'll be drinking a lot. You'll be feeling very thirsty. You will be trying to drink a lot of fluids. Number 3P is polyphagia. You feel so hungry, you feel like eating more and eating more. Number 4 is pruritus. You'll be having itching on the skin because the sugars will have effect on your body. And number 5 is gain of weight. That's another P. You have to figure out what P is that. So those are the symptoms. Plus your random blood glucose has to be more than 200 to stamp you as a diabetic. Number 3rd criteria, this is the last criteria, it's called oral glucose testing. So you come, your blood sugar is good. Like your blood sugar is not 126. Your blood sugar is say 110. Then you thought, oh, I'm not diabetic. But you suspect, oh, he might have diabetes. So you do glucose testing. You give 75 grams of glucose to drink in the water. And then after 2 hours, 1 hour or 2 hours, do glucose testing. If your blood sugar is more than 200, that is diabetic. So your fasting blood sugar may be normal, but if you give glucose 75 gram and do blood sugar testing after 1 hour and 2 hours, it's more than 200, then you are diabetic. It's called oral glucose tolerance testing. And hemoglobin A1C has to be more than 6.5. It's called glycosylated hemoglobin in the blood. If you're less than 6.5, like 6.4, you are pre-diabetic. So your blood sugar is 100 to 126, you are pre-diabetic. If fasting blood sugar should be between 60 to 90. Random blood sugar should be 140 or less. If you have a 140 to 200, that is intermediate range. That means you are having pre-diabetic. So fasting blood sugar between 100 to 126, 125 is pre-diabetic. Hemoglobin A1C less than 6.5 and more than 6 is pre-diabetic. Random blood glucose more than 140 to 200 is pre-diabetic. And anything tipped over that is diabetic. So these are the things I'm done with today. And we will, any questions?
Okay. Is there any question? Or maybe we can close for today, and next week I will collect questions and we can ask them in the next class.
Yeah, thanks for the information. Very good information to know about it. Mhm.
Yeah. Very good.
Yeah.
So next time we'll discuss something. A lot of
Mhm.
things to discuss. This is a like
Introduction.
knowledge to understand what is diabetic, and then we'll go further on the
So,
next.
doctor, I'm taking this metformin,
Uh-huh.
simvastatin, levothyroxine,
Mm-hmm.
lisinopril. Okay.
Mm.
Then on top of that, they said to take glipizide. Mhm.
Uh-huh.
So in the before breakfast. Okay.
Mm-hmm.
So I think my A1C was coming in 7 right now. I think below 7 little bit, but it's above
Mm.
6. Mm.
What is your height?
My height is 5'9". Mm.
What is your weight?
Weight is 184 lb pound.
Okay, let me tell you. Let me find
Mm-hmm.
out whether you're overweight or not. If you're overweight and
Mm-hmm.
obese, you need exercise.
Mm-hmm.
5 feet means 110 pounds.
Mm-hmm.
Every inch after 5 feet is 5 pounds. So 110 plus 9 into 5 is 45. So your weight should be 155
Okay.
but pounds. But you are 185 pounds.
Yeah. Mm-hmm.
Okay. So if you reduce 25 to 30 pounds, then you don't have to take glyburide anymore.
Okay. Good to know that. Yeah.
Yeah.
I'm doing this exercise like tennis every day 1 hour, but that's not sufficient. Looks like. Mm.
That's not, maybe you are eating too much.
Yeah, maybe. I'm trying to, but I'm not eating that
Your
much.
plus minus is cancelled.
Yeah. Looks like that.
Your plan is to reduce weight. No
Yeah.
matter what you do, it doesn't matter. The
Mm-hmm.
goal you have to achieve is reduce weight another 25 pounds.
Yeah, that's true.
Then your diabetes will be gone. You may not need metformin anymore.
Mm-hmm.
You
So
have
you're thinking if I lose 30 pounds, it should be under
or
control.
25 pounds. Just try for 20 pounds first. And
Yeah,
then,
25.
in
Yeah.
3 months, you try to
Uh,
lose 20 pounds. And then
Okay.
we'll see how your blood sugar is.
Yeah, okay. Great. That good to know that.
Yeah.
Yeah. And do you think this I have another question because we are Indians, right? So we eat this. I normally take bread,
Mm.
roti, right? So
Mm-hmm.
is roti is better or this whole wheat bread is better? What we get from Costco. So which one is it similar or something like that? Mm-hmm.
I mean, wheat or rice, they're
Mm-hmm.
all carbohydrates.
Yeah,
Okay.
but
So what I'm trying to tell you, you don't have to eat uh, too much of rice or wheat. A lot of
mm-hmm.
Americans, they eat protein.
Yeah,
Like let me tell you, if you eat a roti, 5 rotis is equal to 1 egg. So 1 egg will give you 60 or 70 calorie, which will equal to 2, 3 rotis.
yeah,
So if you eat roti, you will have more carbohydrates and
mm.
your belly will be full. Then you have to do more
One.
exercise to reduce them.
Mhm.
So I
Okay,
want you to eat more protein diet. I don't want
okay,
you to, so try to make more protein diet, rather like tofu, beans, fish, eggs, not
great.
carbohydrate.
Doctor, sorry, I had need to run to emergency stuff. My
Sure.
Wife has some problem. But thank you
Okay.
for the great session. I'll talk to you
Sure.
next week. Sorry about that. Sorry, sir.
Okay, no
Okay.
problem.
Okay.
We'll talk to you later next week. Thank you. Okay, so we have 1 minute left. We'll conclude the session. Thanks everyone for attending and listening. And we'll meet in the next session, probably on next Saturday or Sunday. Thank you. Have a good rest of the day to everyone. Thank you. Bye.
Okay. Thank you.